My name is Nicole Bruno, and this is task number 15, Fecal Centrifugation with Flotation. Here is my OCCI certification. So first I have all my supplies here. I have my tube, which I'm going to use to spin my sample. I have my wooden applicator stick, and I have my fecal sample. So first what I'm going to do is put about 1/4 gram of feces into my tube. Put it into my tube. Okay. Next what I'm going to do is take my fecal flotation solution, which I have right here, and I'm going to fill the tube about halfway with it. So as you can see, it's filled halfway. So now I'm going to take my applicator stick and I'm going to mix in my fecal sample with my flotation solution. And you want to make sure you get all the chunks broken up. Okay? And once you've done that, I am going to add more flotation solution so that it's about 1/2 inch to the rim. Okay. There we go. As you can see, it's about 1/2 inch to the rim. Okay. I'm going to put this aside. I'm going to put my cap on my tube now, and now I'm ready to begin the centrifugation process. So it's going to spin for 5 minutes at 1300 RPMs. So here's my centrifuge here. I'm just going to move the camera so that you can get a better look. So I'm going to place my sample into the centrifuge with my balance tube, which is right here. We're going to close it, and we're going to set it for 5 minutes. And once it's done, we'll resume. So my sample here has just finished spinning. It was spinning for 5 minutes at 1300 RPMs. So here is what it looks like. So what I'm going to do now is I'm going to uncap the tube, and I'm going to fill the rest with my fecal flotation solution. And then after I do that, I'm going to place a cover slip on top. So I'm going to fill it until it forms a meniscus. Just going to get my cover slip. Cover slip. Here's my flotation solution. So I'm just going to slowly fill it. There we go. So now I have a meniscus on top of my tube, so I'm going to carefully place the cover slip on top. Okay, so now that my cover slip is on top of my sample, I'm going to let it remain on the tube for about 15 minutes. And once that's done, then we can read our sample. So my cover slip has been sitting on my sample slide for about 15 minutes. So now what I'm going to do is take my clean microscope slide, and I'm going to gently place my cover slip onto my slide. So I'm just going to take it off carefully. And I'm just going to place it in the middle of my slide. So now I am ready to read my results on my microscope. I'm going to just turn it on, gently place it to the side. So now I'm looking for any GI parasites on my sample. So if I find anything that looks suspicious, if I see anything, then I will let my preceptor know, and he will also have a look. So I'm starting on 10 power right now. The GI parasites are very common in dogs. They're very common in puppies as well. So I'm just going to show you some examples of some common parasites that are seen. So this here is what a tapeworm egg would look like microscopically. Again, this is the egg. This is not what the tapeworm looks like. These are what coccidiocyst looks like. They're round. They appear to have double nuclei or a single nucleus. That's the easiest way to determine them under a microscope. Here are hookworm eggs. Again, so we're not actually specifically looking for the adult stage of the parasite. We're oftentimes finding eggs, which could indicate still that there is a parasitic infection. And lastly, one of the most popular parasites are the Giardia. So these are what the Giardia cyst looks like. So I'm just going to keep scanning my slide and see if I see any parasites. So on my fecal float slide, I did not see anything alarming or out of the ordinary. Everything looked normal, like normal debris. So what I'm going to do is turn off my microscope, and I'm just going to mark this in my patient's record. So this is my patient's record. I'm just going to mark fecal float, negative, no parasites seen, and the date, 6/28. Okay, and negative, and my initials. So that is how you perform a fecal flotation with centrifugation.